Dr. Priest, it's a pleasure to catch up with you. Thanks so much for the time today.
Great. Appreciate you having me.
All right, and briefly, just off the air, we were talking about what this partnership looks like, having members of Novant Health coming, of course, down here to New Hanover Regional Medical Center in the Cape Fear region, some executive members and county officials from our area going up to your headquarters. Just give us a quick overview of how those types of talks have gone from your vantage point so far.
Yeah, it's been great. So I'm, as you mentioned, the Chief Safety and Quality Officer, and so my focus as part of those talks were, how do our hospitals at Novant Health view safety? How do we ensure that patients are safe? How do we provide the highest quality of care? And I think as we had those conversations with our colleagues at New Hanover, what we realized was we had a whole lot in common. We've started the process of getting to know each other a little bit and doing that due diligence that you do in these kind of things, and what we found is they're providing quality care, they're providing safe care, and so we truly see it as a partnership. I'm sure there's some things they can learn from us, and a lot of things we can learn from them. So we're very excited for the opportunity.
Dr. David Priest, once again with us from Novant Health, a part of our, I would say 7 or 8 interviews now that we've conducted with members of their executive team to learn more about the roles and the responsibilities they have and how they go about what they do day to day. And with that said, Dr. Priest, as you mentioned, you're the VP of Chief Safety and Quality for Novant Health, and in the midst of this pandemic, I'm sure you've been an extremely busy man, along with all of the healthcare workers and others that work within your system. When we talk about plans and preparations, I think the perception for a lot of people is that we were kind of on our heels from, I would say, a societal standpoint as to how much a virus such as COVID could impact us and how quickly it could do that. When we talk from a healthcare standpoint, what are some of the things behind the scenes that Novant Health has been doing and continues to do to plan for these types of things should maybe a surge occur or something else comes on the forefront of our doorstep in the not so distant future?
Yeah, so at Novant Health, we've had for a number of years what we call an emerging infectious diseases team. And this is a group of kind of internal experts in our infection prevention group and our strategic sourcing and our leadership that has been kind of scouring the globe for, what the next global pandemic could be. And some of that came out of, as your listeners will remember, the Ebola crisis, where hospitals had to prepare for a threat that came from another part of the world. And so our team has been thinking through these kind of issues for a very long time, and we don't always know exactly what's going to come or whether the nation as a whole is going to be prepared, but we as a healthcare system wanted to say, hey, no matter what comes our way from where, we've got some capability to deal with that. And because of that team and because of our ability to think through this ahead of time, there was certainly a lot for us to learn, but we were very well prepared, I think more prepared than other healthcare systems for an event like this. So as an example, we had a large number of the swabs you need to run a COVID test. And we know there were healthcare systems around the country that struggle with that, didn't have swabs. We had thousands and thousands of swabs. We have a strategic sourcing team, and that's the group in a hospital system that has to keep up with masks and gowns and ventilators and all these things, and the pharmacy has to keep up with medications. We had warehouses full of a lot of those things. Now, some of those, again, were from our Ebola time, but also just preparing for the worst, hoping for the best, and preparing for the worst. So while we didn't know a particular SARS-like virus was coming, we did have many of the resources in place to start deal with that. And we know as a nation that wasn't always the case. Testing has been a problem. PPE has been a problem in a lot of places. But I think because of some foresight and some planning within our system, we were well prepared to address this.
Dr. David Priest is with us. He's the Chief Safety and Quality Officer for Novant Health, and we will continue this discussion over the next several minutes, focusing on kind of that foundational plan that Novant Health has for dealing with situations similar to the one that we're in right now. Again, it looks like here in the state of North Carolina, we have done a great job in flattening that curve. If you just look from a number standpoint as compared to some other states across the country that have either been hit worse or had a surge later on in this months-long pandemic. When we talk about COVID-19 and another season that is on the horizon, Dr. Priest, obviously school comes around the corner, and then you get the fall and into the winter months. We all know, how our population is ravaged in certain seasons in relation to the flu. Rightfully so or not, people have been using a comparative analysis as to how a flu season looks and what COVID-19 has done to our country. And you could say what you will about that, but with that being said, nonetheless, flu season is around the corner. And how do you see things overlapping with COVID-19 with the upcoming flu season? Can you give us a little sneak peek into the future as to what Novant Health is doing, what we should be doing as individuals that are in control of our own general health and wellness, on how we can prepare and what we should be doing with these two seasons getting ready to overlap one another?
Yeah, absolutely. So I think there's certainly concern, right? So influenza, you almost feel like influenza has been ignored a little bit, and it might raise its hand and say, hey, remember me? I'm responsible for millions of deaths around the world for many, many years. And so we always prepare for influenza seriously at Novant Health. We have a team, believe it or not, influenza preparation and vaccine use and all of those things that we do around influenza is a year-round process. It's not just, hey, in August, let's start thinking about the flu. No, we have a team that thinks about flu really 24/7, 365 in our system. And so when we enter into the flu season, we know every year influenza, like COVID-19, can cause a number of problems. And it puts people in the hospital. It leads to heart attacks and strokes and respiratory failure and death. And so in that way, it's very similar to COVID, and it's spread in a similar manner. So droplet spread, or maybe even some aerosol spread of those two viruses can move the virus through a community. And everybody knows there's some flu seasons that are harder on us than others. They come at various times. Generally, flu season kind of ramps up after Thanksgiving, kind of works into February or March, sometimes even drags into April or May. And so as we think about our hospitals and the number of people in our hospitals and the resources being used around COVID, we then have to ask ourselves, if it's a really bad flu season, how are we going to manage? Are we going to have the resources in the hospital space to be able to manage if the flu season comes in, full bore, or it's a bad flu season like we've had before? One encouraging thing I'll tell you is, to date in the southern hemisphere, where it's flu season now, flu season has been milder. And we're hopeful that'll be the case here. And maybe one of the reasons that's true is the same things that you would do to protect yourself from COVID-19 are going to be the things you do to protect yourself from influenza. So it's hand washing, wearing masks, socially distancing, staying home from work or school if you're ill. A lot of people are having to stay home anyway because they're working from home. But hopefully those things, the strategies are very similar for the two. And if we adhere to those things to protect each other, then perhaps flu season won't be as bad as many fear. We'd also say that obviously influenza vaccine is really important. We don't have a vaccine for COVID-19 yet. We get a lot of people say, well, the vaccine doesn't work very well, or the vaccine, I don't get it because I'm concerned about it. But in reality, even if the vaccine only works 30-40% of the time, it's not so much how much the vaccine works on an individual, it's how many of us get the vaccine. So we can drastically reduce the number of deaths that are associated with influenza the more people get vaccinated, even if the vaccine effectiveness isn't great. It's actually more important that more of us get it than it is to have a vaccine that's 100% effective. So we think if people are wise and get vaccinated early, they do all the same things, they're protecting themselves from COVID, that maybe influenza won't be as bad as we fear.
I know throughout the last several months, there's been a lot of talk of those who are more susceptible to contracting COVID-19 and then having to deal with its adverse effects. I, in fact, came into a run-in with COVID back in mid-June myself, but mid-30s, generally healthy, I'm at good weight, don't have any type of underlying conditions, so I dealt with some of the symptoms, and then by and large have been able to overcome it and get back to a normal type of livelihood. We know that's not the case for everyone who has had to deal with a situation surrounding COVID. Talk about at-risk groups for COVID, the flu, and how important it is to really focus in on bolstering your immune system, doing different things to be generally healthy. And then for those who do have those comorbidities, to take that extra step of caution to make sure they're not putting themselves in danger. For a lot of these people, they've been living this life for a long, long time, very much prior to COVID, given the threat the flu often poses to them each year.
Yeah, so we know that this virus or COVID-19 has a disproportionate effect on the elderly, right? So you look at half the deaths in the state of North Carolina have been in elderly folks. So they're at high risk. Our skilled nursing facilities, nursing homes, those kind of places. All of us have elderly relatives, and this is a much greater issue for somebody like that. It's also an issue for those people who have immune system issues. So if you take medications that suppress your immune system, or your immune system isn't what it used to be, you're going to be at higher risk. We also know it's disproportionately affected people of color and in the Latino communities and population where we are, and so we have to think through all of that as we're coming up with a strategy on how to protect people. So I think sometimes when people say, you know what, I'm otherwise healthy, I probably wouldn't have a problem with it, I'm not too worried about it. That may be true for you individually, but it's not true for all of us. And so we're doing a lot of these things to protect each other. So it's the same behaviors around wearing a mask, and people say, well, it's infringing on my rights and my freedom. Well, it's a minor inconvenience to protect the elderly in our community, or those who have underlying health problems that may have a real problem with COVID. And look, people can have an immune system problem they're unaware of, and even be young and otherwise healthy. We hear those stories of people who otherwise seemed healthy and then died of COVID. So it's not a guarantee that your immune system is in the shape that you think it is. And remember, we think about COVID, it often causes downstream effects. When you get COVID, people often can get blood clots, and that can lead to heart attacks and strokes. So you may not die of COVID, but you could really be seriously hurt or be affected for the rest of your life if you get it. So this is all about protecting us as a community. The more we protect each other, the more we protect those vulnerable populations, the sooner we can get back to a normal state.
Dr. David Priest is an infectious disease specialist, Chief Safety and Quality Officer at Novant Health. A little conversation today surrounding the ongoing pandemic, the overlapping season with the upcoming flu season on the horizon, and how Novant has been uniquely positioned to get a handle on all of these situations from a healthcare standpoint since the very start of this back in March. Dr. Priest, thanks so much for the time today.
Sure, absolutely. Thanks for having me.